in the county. Msonge hivi ndio kujani kabisa. Your Excellency, the ladies and the gentlemen that are here have been working with us, supporting us with the treatment and care, with advocacy, with supply of drugs, with the training for healthcare workers. This is the phase of HIV/AIDS intervention in the county. And I agree with one of very honest speaker that spoke earlier, that HIV/AIDS services is more partner-driven than actually county-driven. And that's something that should worry us. Not that we don't want them to support us, but county should feature prominently in supporting HIV/AIDS. So I will give them opportunity to introduce themselves and also introduce the organization they work for or they work with, starting from here.
The Deputy Governor, Vihiga County, all protocols observed. My name is Irene Ogonda. I work for Nuriam Toto under IDF. At IDF, we support children living positively. We ensure they go to the facility, get medication. We ensure households that we are working with are tested and they know their status. We ensure these children are able to take their medication well. What do we do to make sure that is done? Number one thing, we ensure they get transport to the facility so that they do not miss any appointment. For children with high viral load, we sit down as a team and discuss the matters concerning their high viral load for them to suppress. The third thing we do, we ensure that all pregnant mothers and adolescents are able to access the facility so that they give birth to children who are healthy. And also we are looking at the overall health of this mother. Another thing that we do, we ensure that the households we are working with are economically stable. We work together to ensure that these families are able to put food on their table. We ensure these children go to school, and above all, we look at the safety of these children by ensuring they are living safely. We ensure that we provide them with birth certificate, which I would want to say today that the Deputy Governor is here. Birth certificate in Vihiga County has been a nightmare to us. It is not easy for this family to get access to get birth certificate, and we want to plea that we can work together with your office to ensure that these children get that document because it is one of their rights. Otherwise, thank you for coming, and I pray that all our children are well taken care of by our parents and all partners seated here. Thank you.
Asante sana, tutapigia makofi.
Your Excellency, our Deputy Governor, all protocols observed. My name is Dennis Marwanga. I work with National Endemic Disease Control Council. It's a national agency that deals with endemic diseases, epidemics and pandemics. Our work is to ensure we're able to control epidemics that our people do not suffer, because we realize most of the epidemics and pandemics are not covered by the health insurance cover. So as people access treatment, they don't use their money to give, we realize that most of the pandemics, community usually the money to access treatment. First, to make sure we control the epidemics, and one of them is HIV. For Vihiga County, I think recent statistics have shown that we have a slightly increase in terms of HIV new infections. However, I'm happy to report that we almost are achieving what we call epidemiological control, where we don't have to too much resource on HIV. I think by 2027, our president has directed us that we need to ensure that HIV is no longer a public health issue. So that's the goal we're working towards to. And but the fact that you're here, it shows that the community, the county, that you're able to at least focus on member HIV. And once we partner with HIV, with the organization, we should be able to give you strategies as well as we also capacity build one of your staff to ensure that in terms of response, they're up to date. Other than that, thank you for gracing this occasion, and I hope you continue having this partnership. Thank you.
Mtaniwie radhi kidogo kwa sababu ya muda, tuko na mengi ya kusema. Si ni kweli? Tutasema tu majina, the organization, and just one thing you do. Si ni sawa? ama nimewakanyagia sana?
Your Excellency, the Deputy Governor, all protocols observed. My name is Olive Lidiema. I work with an organization called NEFAC. NEFAC is a community organization. We are happy to be here and looking forward to engaging more.
Your Excellency Governor, my name's Paul Muturi. I work with Coptic Hospital. We offer care and treatment services, including gender-based violence services. Thank you.
Our Deputy Governor, all protocols observed. Good afternoon. I'm Scholastica Owin. I work for Mildme International. We are HIV program. We support the whole county, and we work with the young mothers like the one you've seen here.
Good afternoon, our guests, the Deputy Governor, the CEC Health, all the Ministry of Health officials. My name is Brenda Togo, also working for Mildme International Kenya. We are happy today to be here, to be part of the community celebrating World AIDS Day. Just in addition to what my colleague has said, we are basically a health system strengthening organization, and we cover the whole county, and I hope that when we have a partners meeting, as it coordinates, we'll be able to share more. Thank you. Oh, sorry, we are implementing HIV grant funded by Global Fund, the prevention. We have our donor here, the PR, so he'll be able also to just add on.
Okay, good afternoon, everyone. You're speaking to Edith Akinyi. I work for MEGO in Vihiga County. We do preventions on HIV, but we do not do treatment because we do linkages. So we support typology for MSM and for transgender. So we are happy, and God bless you.
Tunajua MSM. Thank you.
Good afternoon. My name is Edwin Lahalwa, County Coordinator Vihiga, implementing a lot of Red Cross, and standing as the County Coordinator, Red Cross, and we are working with a lot of organizations. As when we want to join the Red Cross, kindly nitawaambia namna hii si mahali pa kupiga siasa, si ndivyo? Sawa, tufanye namna hii. Tutakuwa na drive ya kuhitaji members wa kujoin Red Cross, alafu pia hapo tutajifunza mengi ambao tunafanya. Lakini kwa sasa hivi tusherekee hii siku ya watu ambao wanaishi na ukimwi. Si ni sawa? Ni watu kama sisi, tuwapende, ni majirani zetu, ni mandugu zetu, ni wazazi wetu. Si ni sawa? Ni hayo tu, nitarudi kama nimejipanga kivyangu, si ndivyo? Tusichukue muda mwingi. Asante.
All protocol observed. Good afternoon. I'm Chebet Eva. I work for Anglican Development Services. As a faith-based organization, we are here to support the county. I'm implementing a project in Mwibona Ward, Moments That Matter. God bless you so much.
Your Excellency, the Deputy Governor, all protocols observed. My name is Okoti Anthony. I work for S Africa. We are implementing a project that is providing HIV education to adolescent and young girls in Luanda sub-county using drama. Thank you.
Thank you.
To the Deputy Governor of Vihiga County, all protocols observed. Good afternoon, everyone. My name is Zilpo War. I work for Impact Research and Development Organization. Impact is a local NGO with its headquarters in Kisumu. It is funded by Kenya Red Cross through the Global Fund. We work in all the 6 sub-counties, in all the 5 sub-counties of Vihiga. Basically, we do HIV prevention, and I'm here with my site coordinator and my beneficiaries here. We feel privileged to do implementation in Vihiga. Thank you.
Thank you very much.
The Deputy Governor of Vihiga County, all invited guests, ladies and gentlemen, good afternoon. Yes, my name is Patrick Ogutu. I work for USAID Nuri Mtoto program. USAID Nuri Mtoto program works in partnership with the county government of Vihiga and other local implementing partners to do two things. We do HIV treatment, care and treatment, and we also do OVC in Vihiga County. Without going into much, Your Excellency, allow me just say one thing. We've looked at the data that is coming from our facilities, and one thing that we are noticing is that there's an increase of the NCDs among people living with HIV.